Hi friends, I am Dr. Krishna Kumari. Welcome to Sparsh Homoeopathy. It is the continuation of the homeopathic management of tonsillitis. Today we can start with Hepazolf. Hepazolf, it is similar to belladonna and it follows belladonna. The rawness and scraping sensation, heat feeling and oversensitiveness to touch, cold, pain, etc. similar to that of belladonna. And Hepazolf, one of the causative factors is exposure to dry cold wind. And there is a splinter-like or fishbone-like sensation in the throat, and this pain radiates to ears. And there may be suppuration or may not suppuration, and there can be peritonsillar abscess also. And the starting of pain with the rigor, chill, etc. shows the onset of suppuration. And the person is very chilly, complains after exposure to cold, and patient wants covering. And there can be profuse sweat all over the body, and the complaints can occur during winter season. And the Hepazolf, there is chronic enlargement of the glands which produce hardness of hearing, and there is very difficult to swallow also. And the Hepazolf in higher potency, the first dose is given in higher potency. It prevents suppuration, and if there is suppuration, it aborts it with the suppuration. Next medicine is Silesia. It is indicated after Hepazolf when the abscess has discharged, but it failed to heal. The pus keep on forming with an offensive odor and a bad taste. And there is chronic form of tonsillitis with a pricking pain in the part. And it's a remedy for chronic cough with tonsillitis in scrofulous children, for fistulous tonsillitis with a profuse sweat and offensive sweat on scalp, but it is less than calcareous cough. The Silesia patient is highly chilly, very sensitive cold, and complains better by warm application. Then complaints can occur after recurrent vaccination and suppression of foot sweat. Then the Dr. Farrington has the opinion that one dose of sulfur after Silesia will cure the case. And Silesia, there can be enlargement of gland, tonsil with the enlargement of the cervical glands, and cervical gland suppurates and it never heals. Next medicine is mercurius. It is rarely at the onset of the disease. In little bit advanced cases rather than it calls for Hepazolf when pus has formed. There is much swelling of the fauces, and right tonsil is mainly affected, and tonsil is dark red in color. There is much accumulation of tenacious mucus in throat. The tongue is very large, flabby, with offensive breath, and there is profuse salivation. The tongue is, even though the tongue is moist, there is thirst with a constant metallic taste in mouth. There can be enlargement of glands. The complaints can worse, the pain worse at night, exposure to damp weather, warmth of bed produces aggravation, and there can be profuse and offensive perspiration, and perspiration aggravates. Tonsillitis can occur from change of weather, and when days are hot and nights are very damp and cold. Merc protoiodide, the superficial part of tonsil is affected. Right tonsil is mainly affected. Tonsil is red in color with a constant desire to swallow. And there can be there are cheesy exudate on the surface of the tonsils. The tongue is coated yellow at the base, and the tip and margin reddish in color with imprint of teeth. And there can be enlargement of tonsil and other glands around neck with an offensive breath. Next medicine is merbine iodatus. Here it is parenchymatous tonsillitis, and for peritonsillitis, all glands, tonsil and other glands in the neck is enlarged. So there is a disposition to hawk frequently. And left tonsil is mainly affected. There can be suppuration of the tonsils. Swallowing is very difficult than empty swallowing is very difficult than swallowing solid food. Aggravation, cold air, cold climate, and touch and pressure also produces aggravation. Next medicine is Beritacar. It is for acute tonsillitis. It is usually in mild form. There can be enlargement of tonsil after exposure to cold wind, and enlargement of tonsil especially in scrofulous children and mentally and physically retarded children. The right tonsil is mainly affected, and there can be suppuration, tonsil rarely separated, or it may or may not be separated after exposure to cold. And every cold settles in throat. There is remedy for chronic enlargement of tonsil with the chronic cough, especially in scrofulous children. It is a dose of Beritacar in higher potency abort the case or eradicate the constitutional tendency of tonsillitis. It is a remedy for tonsillitis after suppression of food set. It is indicated more than Silesia because it has a special affinity to throat. Then Soranum follows well Beretta carb to eradicate the constitutional tendency of tonsillitis. Then sulfur and tuberculinum follows. Next medicine is Beretta iodide. It is for chronic cases. There can be quinsy and enlargement of glands, especially in children with stunted growth. And there can be enlargement of cervical glands. Next medicine is Beretta mure. Beretta mure, the tonsil is very much enlarged and tonsil look like plums. Then there can be radiation of pain to neck and radiation of pain to ears found in Phytolacca, Hepazalf, etc. Next medicine is Voronum. The tonsils enlarged and our cervical glands are enlarged. It is a remedy for quinsy and prevent the repeated attack of quinsy. And right tonsil is mainly affected, and there can be hawking up of cheesy balls like a pea. And the person is chilly, complains aggravation during winter season, and exposure to cold produces complaints. And better by warmth and covering. There can be profuse sweat all over the body, and patient wants to cover in hottest summer weather. And this perspiration ameliorates the complaints. In Matsol, perspiration aggravates, but Soranum, perspiration ameliorates the complaints. Then comes an important remedy, Calcarea car. Here, constitutional symptoms are very prominent. The tonsils and submaxillary glands are enlarged, and chronic enlargement of the glands. And it is a chilly patient, and the tendency to constipation is there. And for acute attacks of tonsillitis, we can think about belladonna while treating with Calcarea car. Then Calcarea sulf for last stage of suppurative tonsillitis when the abscess is discharged. Calcarea floor, it is a remedy for follicular sore throat, and all the complaints better by warm application, warm drinks, external covering, etc. amelioration. Then comes lachesis. The tonsils inflammation begins on left side and go to right side, and there is bluish purplish discoloration of the tonsil. There is constant desire to swallow, and swallowing liquid is more easily than swallowing solids. And the throat is very sensitive to touch and pressure, and the pain worse during sleep and after sleep, or sleep into aggravation. Deep sleep produces aggravation of the pain, and after sleep there is aggravation. And there is extreme prostration out of proportion to the appearance of the tonsil. The person is very hot. Then comes Sabadilla. Here also the complaints begins on left side and go to right side. And there is patient can swallow. Opposite that of lachesis, patient can swallow warm food, and there is a sensation as if skin is hanging over the throat. Then lacananum, complaints begins on left side and go to right side, again come to the left side. Like lachesis, the throat is very sensitive to touch and pressure, and there can be sore throat and cough before and during menstruation. Enlargement of glands around neck also in lachesis, and there is a constant desire to swallow and swallowing very difficult, and pain radiates to ear like Hepazalf, Calibi, then Phytolacca, etc. Pain radiates to ears. Pyrogen, gunpowder, Crotalus horridus, then Cantharis, Tarantula cubensis, etc. for septic inflammation of the tonsils. Then pyrogen, there is septicemia with the suppuration of the glands, and there can be offensive breath, taste of pus in the throat with a smell similar to that of cadaver. And the tongue is very large, flabby, showing imprint of teeth, and show as if very clean, as if varnished, and fiery red tongue. And there is extreme prostration, and there can be fever along with tonsillitis. Pulse is rapid, out of proportion to temperature, and patient shows restlessness. Then comes gunpowder for septic suppuration of the tonsillitis. Extreme prostration found in gunpowder. Then Crotalus horridus, tonsil is very throat is very dry and swollen tonsil. Tonsil is dark in color, and for septicemia, then gangrenous tonsillitis, and there can be bleeding points on the tonsils. Cantharis is very severe form of tonsillitis, and gangrenous form of tonsillitis, and swallowing is very difficult, and there is a constrictive feeling in throat very sensitive to touch and pressure, severe burning pain, and feels as if on fire. Then comes Tarantula cubensis. Here also septic condition, most malignant case of tonsillitis, and there is much inflammation and extreme prostration also. These are the important medicine about tonsillitis. Thank you.